Mr. MacPherson, what can we do to strengthen community ties and protect seniors from these bad actors?
There's a lot we can do. The community-based interventions that we've heard some of them here today are just critically important. I think we need to take a settings approach, Mr. Chairman, to this issue, whether you're talking about health centers, community centers, housing, schools, workplaces, places of worship. Our 130 policy recommendations that we just released today addresses all of those settings and ideas for the federal government, but also states to invest in as I said, a comprehensive approach to a really challenging problem. Again, going back to the Older Americans Act, it's just critically important that we protect that funding, expand that funding. It's a drop in the bucket in the federal budget that has a outsized impact on seniors across the country. The last thing I'll say is that we've touched on intergenerational today, but I think it's worth emphasizing that. Ranking Member Gillibrand, you have an extraordinary program in your state, DeRote, which is a member of our steering committee, that receives funding from the Older Americans Act and private sources as well, that has a whole range of intergenerational programming that has been very successful in not just addressing social isolation and loneliness, but also addressing the well-being of the communities that they serve. So this is a complex issue, and there's a lot of different ways to address it. At the Foundation for Social Connection Action Network, again, we've got almost 70 national organizations involved in our work to come together to find to a whole range of solutions. So thank you for the question.
So you've had 20 years of work in the healthcare policy space. What do you think is the most effective, or one of the most effective, I'm sure there's a lot, of initiatives that combat loneliness among seniors?
Yeah, I really appreciate that question. 20 years.
Is that true?
Look, it is true. Thank you for saying that. My hairline says it.
Have some.
I'll say raising the visibility of this issue is the most important aspect from my perspective, and this hearing is a critically important way to do that. Look, there's still a lot of stigma in this country around being socially isolated and or lonely. The way that we break down those barriers and allow people to be more connected at a very fundamental level is to talk about it. So that's number one. Number two, as I said, the former Surgeon General, I think, did an extraordinary job in raising the visibility of this issue and releasing a number of really thoughtful reports, went all over the country and talked about this. I'll give you some more specifics, though, in healthcare policy, Mr. Chairman. Medicare Advantage. In 2018, Congress passed the Chronic Act, okay? And the Chronic Act was widely bipartisan, and what it did was allow Medicare Advantage plans in supplemental benefits to offer non-medical benefits, things like nutrition services, home-based palliative care, non-emergency transportation. If I think back over 20 years of doing this work, that was critically important. As Medicare Advantage was growing in the program, it was critically important that Congress gave them, and the Trump administration at the time as well, gave the plans the opportunity to provide benefits that were non-medical in nature. We would love to see that expanded. We would love to see hearing reimbursement, for example, for hearing devices, and hearing moved into original Medicare, which would create more space in supplemental benefits for more non-medical approaches. So those are just some examples, Mr. Chairman, of things that I've seen over the years that I think have been really impactful.
Do you think the Senior Acts would help groups that you work with fight loneliness?
I mean, look, absolutely. So the previous reauthorization of the Older Americans Act in 2020 included added, I should say, the word social isolation. This is before the pandemic, by the way. Added the word social isolation to the Older Americans Act and attached about $250 million for ACL to implement programming. That programming was wildly successful and I would argue saved the federal government money. By adding loneliness, Mr. Chairman, that allows the resources in the Older Americans Act and senior centers, nutrition programs, et cetera, to direct funding at the public health epidemic and crisis. So we are 100% supportive. We're excited to see it, to advocate for it and get more co-sponsors, and we're eager to see it pass the Congress.